Hello, and thank you for joining us. This presentation is brought to you by the Primary Health Network, Great Ocean Road Health, Colac Area Health, and HESI Health. And we're here to share with you information on menopause for World Menopause Month. It's also World Menopause Day coming up on the 18th of October. So for this year's theme for World Menopause Day, we're going to talk about menopause and menopausal hormone therapy. So just a disclaimer, this information has been taken from the leading women's health and menopause associations. This is a narration of this content and not to be taken as medical information. These notes are for informational purposes only and a self-help tool for your own use. You should always consult your own GP or health professional for personalised information. So what is menopausal hormone therapy? This is actually a new name. You may not have heard of it before. It's the old version of HRT. So it's now called menopausal hormone therapy, and it's known as the best treatment to improve menopausal symptoms. What is MHT? Well, it's a form of hormone replacement therapy, and it supports about 1 in 4 women to reduce the symptoms, bothersome symptoms, with hormone medicine specialised for them. So we do know that, 1 in 4, as I said, have a need for MHT to support symptoms such as hot flushes, night sweats, vaginal dryness, and urinary symptoms. And there's many other symptoms that can be supported as well. Some people experience no symptoms, and others experience many symptoms. So other symptoms known are brain fog, forgetfulness, difficulty concentrating, mood changes and anxiety, night sweats and hot chills, and cold chills sometimes, muscle and joint pain. It's another one. Fast or strong heartbeats, lowered sexual drive or desire, dry and itchy skin, headaches and migraines, crying spells, being more emotional, losing some feeling in hands and feet and some numbness, and also some weight gain. More information on this can be found on the Jean Hale's What's Bothering You page. And we'll learn more about how to support ourselves with these symptoms. So it's recommended as well, so not only for people who are of a postmenopausal age, but also for people who have experienced earlier menopause or may have had premature ovarian insufficiency when menopause happens before the age of 40. Who might not need MHT? Well, some people go through menopause at the natural age and they have no bothersome symptoms. They don't know what all the fuss is about and they just don't need MHT. MHT is not recommended for these people. It's not going to prevent aging or memory loss or dementia. The different types of MHT. So it's often prescribed by your doctor for your specific needs as a tablet or capsule, a skin patch, a gel or a cream, or maybe vaginal suppositories. So different types of MHT are going to be associated with different risks, and you'll need to work with your own GP to figure out what's best for you, depending on your specific circumstances. MHT is a supplement of hormones that your body gets particularly estrogen and progesterone, that are crucial for managing symptoms and protecting your longer-term health. So we know estrogen is the main hormone used in MHT, and it helps to reduce hot flushes, night sweats, and vaginal dryness. But progesterone is still given to women who have a uterus, and it can help the womb, protect the womb lining from growing too much when taking estrogen. We do caution you against bioidentical hormones, pharmacy compounded hormones, not prescribed by a GP, are not recommended due to many of the reasons that we'll tell you about later in this presentation. So MHT should be started to relieve symptoms of menopause. So it's really effective for that. And in early menopause or premature ovarian insufficiency. It also should be not necessarily stopped for any one-size-fits-all amount of time. Some women use it for only a few years and others may need it for longer. This is, again, something that you'll need to be guided by your professional on. There are some risks associated with MHT. It is associated very slightly with breast cancer, but this is particularly correlated with long-term use. So again, we'll talk about this later, but the slight number of increase in breast cancer is probably when MHT is not managed effectively. So that if you're working very closely with your health professional, monitoring your symptoms and not using it over too many years, your risks is very slight. Blood clots. Yes, there is a higher risk of blood clots with MHT, and particularly when MHT is in the form of tablets. Stroke has been associated with MHT, and older women may be at higher risk, and this is why it's so important to really have your own health journey documented, continue to see and have checkups and monitor your blood and your stroke risk along with your GP. People use MHT really to manage those problems and symptoms. So not only does it support, as we said, the hot flushes and night sweats and vaginal symptoms, but really protective for bone health to prevent osteoporosis, which is a condition that can weaken bones and lead to fractures, as well as heart health. For some women, MHT may even lower the risk of heart disease, especially when started close to the time of menopause transition. Some people believe MHT is a fountain of youth, but there is little scientific evidence for this, and it's important to remember that MHT is not recommended solely to prevent aging, memory loss, or dementia. There is no strict limit on how long you use it, but using it longer can increase the risk, as we discussed. So please be guided by your trusted health professional. Why do people consider MHT? Well, we've spoken about this slide as well, so I'm not going to go into it again, but it will support your symptoms. MHT myths. Okay, so these are really common. There's a misunderstanding that MHT will make you put on weight, but there's no significant evidence of this. Aging, social, lifestyle, medical factors are the main cause of midlife weight gain. Myth 2, breast cancer is the most common cause of death in postmenopausal women. Fear of breast cancer is a major reason why women don't use MHT, but many postmenopausal women believe they're more likely to die of breast cancer than stroke or heart disease, but the opposite is actually true. So findings have found that only 1 in 4 in 100 women die from breast cancer. So it's not the most common cause of death in postmenopausal women. Myth 3, understanding that 1/4 of women who take MHT get breast cancer. Sorry, that's a misunderstanding because it was incorrectly reported by journalists with early study results. New information has since gained a better understanding that 5 years taking combined MHT, the estrogen and progesterone, did not increase breast cancer risks in women aged 50 to 59 or in women who started treatment within 10 years of menopause. After 13 years, women had only a small increase in breast cancer risks. Myth 4, MHT increases the risk of heart disease. Evidence shows that MHT did not increase the number of deaths from heart and blood vessel disease or heart attacks, and it did not increase the number of cases of angina. And again, it has been found to support and reduce heart disease in women. Myth 5, a blood test is necessary to diagnose menopause. No, we don't rely on a blood test to diagnose menopause. The diagnosis is if a period or menses has ceased for 12 months, you are considered to be menopausal. Before that, it's a perimenopause stage where a lot of the symptoms are evident. And some women vacillate between menopausal and perimenopausal for many years. Myth 6, complementary medicines and therapies are as effective as MHT and safer. This does not have the safe and sound rigorous evidence to support this claim. Products such as soy, should be avoided if you're if you're unable to be prescribed MHT. And often there's no way to know if these products are actually safe. So we don't recommend them over MHT. Also, the compounded bioidentical hormone therapy that we talked about earlier and had the caution slide, that is not recommended. Doctors advise against the use of those compounded bioidentical hormones because they are chemically the same as the body, but they are often not rigorously tested, and there's disadvantages. There's no regulations for their use. There's no standards of quality manufacturing, no testing of the products for negative effects, and there can be serious side effects such as endometrial cancer. Myth 8, misunderstanding. All progesterones have the same risk. This is untrue as well. The risk of cancer in the uterus in women who still have a uterus, progesterone is recommended to reduce this risk, but different progesterones have different risks. Your doctor can discuss the different risks, so because there's different forms of progesterone. Myth 9, misunderstanding is that non-hormonal medications are as effective as MHT for hot flushes. I think there's been many a herbal supplement thrown around, but the studies don't suggest that they're more effective at all. So please look for the evidence, talk to your doctor. Where can you find information about MHT and other treatment options? So the Australian Menopause Society fact sheets, such as what is menopausal hormone therapy, MHT, and is it safe, will guide you further and give you really up-to-date information from a trustworthy source. So please continue to talk to health professionals and find information that's been rigorously tested and evidence-based. There's so much out there on the internet, and a lot of it has no solid evidence base. So we do encourage that you really go for the right evidence and talk to the right people. Final tips and takeaways. Stay informed. Talk to your professionals, and don't suffer in silence. Many women do experience relief from MHT, but there are other options available. If you are looking for an AMS doctor, you may look at the Australian Menopausal Society, and they have a list of experienced GPs. Many questions and answers can be found on the Jean Hale's website. I highly recommend their podcast, the Menopause Checklist podcast. It's really great and funny, and can answer many of those questions that we don't know where to go with. So please look that up as well. Thank you so much for your time. For more information, reach out to your local health team, Hesse Health, Colac Area Health, or Great Ocean Road Health. All the best. Thank you.